Hi, so I'm back with another Nclex tip, and this time our Nclex tip is talking about prioritization. A lot of times a nurse has to prioritize or determine who will need immediate care. How will you know on Nclex that the question is asking you about prioritization? You have to think about things like initially, or what should the nurse do first, or it may ask you something like, which nursing interventions need highest priority, or even which intervention is the most essential. So some of the factors to consider when you have to answer an Nclex question that requires you to determine priority, you can first think of safety factors. Consider your ABCs, airway, breathing, circulation. Remember that applies except in CPR. When we turn the algorithm into CAB, circulation is more important. Another aspect of safety has to do with Maslow's hierarchy of needs. If you can remember that physiological needs come first, then if your patient has, let's say, a drop in blood sugar or an insulin reaction, anaphylactic reaction, aspiration, or even shock, then you know that they will take priority. Immediacy of care will be necessary. Another factor to consider with priority questions is the level of care that is required. There are many different systems that we can use to determine level of care. Today, I'm just going to talk about a three-tiered system, a first level, a second level, and a third level of care, where the first level of care is the immediate life-threatening situation that the nurse would attend to first. So for example, first level of care situation, any exacerbation of symptoms or exacerbation of a medical condition. For example, your patient has a BUN of 42, I'm just throwing labs out there. Or if there are any untreated medical problems, like the hypertensive patient needs to get their medications now. Something like that in a question. Any large fluid shifts, whether it's a fluid volume excess or a fluid volume deficit, that would be a first level care priority. It would need immediate intervention by the nurse. Another first level priority of care would be if we need to administer any IV medications, or maybe something like a pain, patient is complaining of pain but you don't yet have treatment orders, something like that would make it a first level care priority, and you have to immediately attend to that. Second level care priorities can become life-threatening or are potentially life-threatening. So things that you would leave for the second level of care would be, for example, your scheduled meds. Any discharge teaching, we don't have to do right away if we have something more importantly. Or if there's a change in mental status, change in the psychological status, that could also be considered a second level of care. It's not your highest priority, but it's right there. It could potentially become a crisis. Another thing to think about with priority is the third level of care. And those things are usually our ADLs, comfort, hygiene, mobility problems, knowledge deficit. Those things we can do a little bit later, but anything life-threatening is a first level of care priority. Another factor to think of, so we've covered safety and we've covered the levels of care. Another factor to think of that influences or determines priority in our Nclex questions is whether the patient is stable versus the unstable patient. Of course, we know that the unstable patient is always going to get your priority first over the stable person. So if the patient has like a chronic illness, for example, that's considered a stable person. They've probably been living with this problem since the last 20 years or a decade or so. Unless there is an exacerbation, change, some atypical presentation in that chronic illness, then they will become unstable. But if you have a chronic illness in the question option choices, the answer options, versus an acute illness, the acute illness is going to be the more unstable of the two, and that would take priority. If your patient had local anesthesia, they're not going to be priority over the person who has general anesthesia. General anesthesia, you're going to be a more unstable person after we wake you up, and so that person will take priority. If someone is post-op less than 12 hours, that's considered an unstable patient. Again, the unstable client or unstable patient will get priority over someone who had surgery or had an operation more than 12 hours ago. So if you're post-op more than 12 hours ago, you might not be priority, but if we have a patient in the same question that's post-op less than 12 hours, that's the priority person. We want to take care of you because you're fresh out of surgery. If in your choices it says something like newly admitted, newly diagnosed medical problem. Those are your unstable people. You have an unexpected reaction, an atypical reaction, or any one of the H's. For example, if it says a patient has hypoglycemia, that's going to be a more unstable patient. Patient with hyperpyrexia, a fever of 102, 103, something like that. That's a priority patient. Or if we have no, bradycardia, no pulse, very, very low or no respiratory rate, those are priority clients. Another factor to consider with answering priority questions, the more vital the organ is to life, it's the more higher the priority that we would give to any dysfunction in that organ. So if you are unsure whether it's a stable or unstable thing, you've already gone through your safety factors, you've already looked at level of care, you can also consider the organ system. For example, the brain as a system or as an organ is going to have higher priority over the lungs and heart, even though we can't live without either. But the brain controls everything. Liver might get priority over the kidneys. So these are some of the factors you want to use to help you with priority questions. Remember again, safety are factors, whether the patient is unstable or stable. Unstable always wins first. Consider the levels of care, the different priorities in your levels of care. Immediate life-threatening situations will always win over comfort and ADLs. And then also consider the more vital the organ, it's a higher priority you would give to it. Today we covered prioritization. What should the nurse do first? What should the nurse do initially? What interventions the nurse should give highest priority? Like, share, subscribe, or book a tutor, Rnpn Tutors USA.